The FDA tweeting, "You are not a horse, you are not a cow." Seriously, y'all, stop it.
Ivermectin is not a recommended treatment for COVID-19. It is not a recommended drug to prevent COVID-19.
Ivermectin.
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 And Ivermectin.
Ivermectin.
All coming back to some sort of mind control.
Ivermectin, which can and is around the world used to treat and prevent the spread of the coronavirus. It's not some crackpot fish tank cleaner. It's a real drug.
I'm not a medical expert. They haven't even given emergency use authorization for Ivermectin.
If it's extremist to wonder about the origins of COVID, if it's extremist to wonder about the utility of masks outdoors, if it's extremist to wonder about ivermectin as a therapeutic drug, then count me as a radical.
Hi, I'm Beth.
And I'm Stainy.
And you're listening to Mixed Politics. Welcome to episode 19. What?
I just, I don't know. Is the topic. I think it's the topic.
Okay. I was going to say.
But we'll get to that.
Okay. Well, what are you drinking?
I'm drinking what I have called is it an or a? An H-bomb.
Nice.
Yeah.
Okay. So it's your own creation?
Yes, it has rum and ginger ale, which I love mixing with rum, lime juice, and a splash. So a splash meaning less than 1 part of Heineken.
Oh, wow.
And that's the H part.
It's an interesting combination.
Yeah.
Okay.
Mm-hmm. What are you drinking?
Oh, I'm just drinking a margarita.
I hope I make it through this thing because with mixing liquor and beer, I'm not in the clear. It's not. Yeah. So, what are we talking about tonight?
What's going on with Ivermectin?
Oh God! I swear, the last number of topics have just been
I know. No, for me, I'm really hyped up about this.
Oh, you are?
I'm excited to talk about this because it's just such a train wreck.
Okay.
And, you can kind of get what's going on just by listening to the news for 5 minutes. This is a really cut and dry situation.
Yeah.
Pretty much. That people are dumb.
I just, you know what though? I don't know, before I get more drunk and involved in this podcast, I want to make it clear that I'm not trying to scare anyone with the things that we might impart to you tonight.
No.
But I'm also hoping that the people who do listen to our podcast and watch our podcast aren't the people who need this information.
Right.
I'm just hoping. But if you do need it, I hope you get it because I don't even really want to impart it. I just want to laugh and just go to bed or go hang out.
We're just trying to inform people. That's all. We're going to give you the facts and we're going to help to think outside the box a little bit as to how we got here.
Yeah.
We're going to start with Joe Rogan because he's very popular. Lots of people know who he is. Whether you listen to his podcast or not, you kind of know what he talks about.
I was trying to explain to a friend because when he recently came down with COVID.
Yes.
And I was trying to explain to a friend, why is this guy important with the whole COVID thing?
He's very important.
He's very important because he has a large audience.
Yes.
He has the entire UFC audience. He has anybody who's involved in fighting, boxing, martial arts, mixed martial arts, MMA, whatever. But his podcast also has millions of listeners.
Yes.
Not 1 million, a couple, a lot of million people per episode, per whatever.
Yes.
So he's very influential. His platform is very large. And oftentimes, I've listened in a few times, he's just the dumbest, I don't know. I don't know if it's a shtick where this is the stuff that he does to make his podcast popular. But he'll just come, he'll be talking about anything on the podcast. Anything at all. Maybe something important, maybe something political. And then he'll signal to the producers and he'll just go off on a tangent. And that tangent will be 15 minutes. And he'll be have you seen grown giraffes' balls? They're the biggest balls in the animal kingdom. Pull up a picture of giraffes' balls. Just pull it up. See? And everybody's oh shit, they're so fucking big. And oh my God. And that's what people listen to.
Yes.
And now they're getting medical information from this.
Well, that's why he's important in this conversation because he's been extremely vocal on his podcast about if you're healthy, if you exercise, if you eat right, you don't have to worry about COVID.
And throughout the night, I got fevers and sweats, and I knew what was going on. So I got up in the morning, got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, Ivermectin, Z-Pak, prednisone, everything. And I also got an NAD drip and a vitamin drip, and I did that 3 days in a row.
So he came down with COVID. Apparently, he's not as healthy as he thought he was. It just goes to show that you can eat well and you can exercise, but your immune system, it is somewhat connected to that, but not holistically connected to just diet and exercise.
Yeah.
I'm a good example of that because I eat very healthy, very clean. I exercise regularly. My immune system is shit because of things that happened about, how I grew up, where I grew up, what I used to eat as a kid. Mm-hmm. So he was spreading information to his listeners saying, if you're healthy, you don't have to worry about this. So as soon as he got the virus, he said he threw the kitchen sink at it, which shows you he's full of shit. He's full of shit. Because if he said, you don't have to worry about this if you're healthy and exercise, why the fuck is he throwing all this shit at it? So he did,
He took 5 things, didn't he?
Yes, he was doing the monoclonal antibodies, Ivermectin, vitamin drip, Regeneron, all of this Remdesivir.
Okay.
He did. So here's the one thing I want to say. He went in so hard on all of these therapies all at the same time. He's doing better, he says. But how do you know which one of them worked? How do you know which one of them worked?
It's a cocktail. I don't know.
It is a cocktail.
He literally poured all of this shit in the drink.
He could have beat it on his own. He could have beat it based on one of.
He wasn't willing to take that chance, though. He wasn't willing to take that chance.
That's why he's full of shit.
He's ready to, But here's the thing with him though. I don't know if we can find video or pictures or whatever of him prior to him getting COVID. He was all about it's just the flu.
Right.
Like you were saying, if you're healthy and you exercise, you eat right, you whatever, you'll be fine. It's not killing young people. Like he's okay with old people dying. Like you don't have old people in your family. It's so weird to me.
Yeah.
But that was his thing, and as soon as he got it, he's just like, give me everything.
So it sounds like it's not just the flu. If he's gonna, the last time you got the flu, did you take 5 different forms? Did you go to a doctor and have them give you 5 different forms of therapy all in the first day?
No. It was the first day too. It wasn't like, oh, he's on his deathbed, let's now try these things. He was like, first day, he was just like, yes.
So about being healthy, do you know who Bill Phillips is? He is, okay, so he wrote the book and the program Body for Life. I did this when we were in college, and I did it again in my early 30s. It is a program that's clean eating, it's exercise, it's very healthy.
Yeah.
This man was buff, and I forgot to bring his book here. I would show you let's put up a picture of what he looks like, because you guys might recognize him if you're not familiar with the name.
Is he like an older Fabio?
He's super buff. He's very fit. And he does a lot of personal training. Mm-hmm. I mean, he's a very good source of information for diet and exercise for a lot of people. He got COVID twice. The second time he got it, he was intubated for 47 days.
Oh, wow.
He lost 70 pounds. And he's now in a wheelchair. So
forever or just for
at least temporarily.
Oh.
So if you're going to talk about, if you listen to Joe Rogan and he says, if you eat healthy and you exercise, you don't have to worry about this. Number one, he lied to you because he worried about it the day he got it. But also Bill Phillips.
Yeah.
That is a prime example of diet and exercise not saving you from COVID.
I've been known that that's a bullshit argument.
Of course.
Though, because I think when, so the NBA had the bubble thing and whatever, and they started this season. And I think at the beginning of the last season, Jason Tatum, which is the star of the Boston Celtics, if you are an NBA fan or watch whatever, he had COVID. And if you look at that guy, we'll put up a picture of Jason Tatum here. He literally looks like Apollo. He's chiseled, and those guys, they work out, they have specific diets, they have specific training regimens, whatever. He had COVID. Apparently, after he recovered from COVID, he now has to use inhaler.
Oh, yeah.
Before and like during and after basketball games,
right?
Because like it fucked up his respiratory system.
Exactly.
And I'm like, I don't know why people think that's the flu. Like people don't.
It's because of people like Joe Rogan. It's because of people like Alex Jones, both of whom are taking ivermectin. So I think this is a good opportunity for us to talk about what ivermectin is, because these people are putting out this message that, hey, just take this stuff if you get sick and you'll be totally fine. But some of these things are very dangerous. So I think that we need to talk about what is ivermectin.
All right, so
keep going.
And I'm like, okay, ivermectin is an antiparasitic dewormer that's used for both animals and humans. A lot of livestock, a lot of farm animals, and whatever. And just by me saying that, the first thing I think to my mind is, why the fuck would you take this as a human? Like, why? It's used for horses and cattle, sheep, whatever.
Yes. Now there are some legit reasons why people do take it.
Yeah.
But
no, for humans. And here's the thing. There's like two different brands or sources of ivermectin. Like the one that's for animals, and then there's the one for people.
Yes.
The one for people is topical.
Yes.
Topical means on the surface, like you rub it on your skin.
Yeah.
It's not something that you take or you ingest. And to go back to what I said before, I'm not trying to like scare people, but there's not really any ivermectin for humans that you ingest. In very rare cases, the people who are immunocompromised and have other health problems, they have a formula that you can ingest. However, the amount that you're supposed to take based on how much you weigh is for humans, micrograms per kilogram that you weigh.
Yes.
For animals, it's grams per kilogram, that like the horse or the cow or whatever, to get rid of heartworms, roundworms, pinworms, whatever. For you, I'm trying not to laugh, but you and I don't have anything in our household that can measure a microgram.
No.
So no matter what you decide to measure your ivermectin in, you are going to overdose yourself. Like just from the get-go. Because you don't have anything in your house. Right. Unless you're like a chemist. You're probably not.
Well, if you're a chemist, you're probably not going to do this in the first place.
Jesus Christ. I know.
Just saying.
So if you can't measure out micrograms per kilogram that you weigh, you're probably overdosing yourself to begin with.
Yes.
So it's an antiparasitic. Things like schistosoma, things like roundworm, pinworms, or whatever we said before. And it's not for treating a virus.
No, because a virus and a parasite are two very different things.
God. One's an actual like living organism. Never mind. I don't want to get into what I don't want to get into what I studied in college. But let me tell you something. I'm never going out to go purchase ivermectin until the day I die.
No, not for me at least. Maybe for my cats, but not for me.
So it's an antiparasitic. It's a dewormer. And in some cases, for the very, very immunocompromised, people who but need treatment in other areas, like you have cancer and you're taking chemo or whatever, they can use it in microgram dosages to assist with boosting your immune system or boosting whatever. The regular general public, person that's living in Missouri, who's just like, oh my God, I got COVID. It's not something for you to be just like taking topical creams and ointments and shit and like putting it in your mouth.
Right.
That's not what ivermectin is.
Right.
And if you want to know what ivermectin is, you can literally Google what is ivermectin, or go to Merck, the name of the company that makes it, and go to their website and they'll tell you straight up like what it does, what it's for, and what's in it.
Yes.
And that's a whole other topic. So, oh boy.
So, speaking of Merck, they are telling people not to take this for COVID. So there's a lot of talk about Big Pharma and how Big Pharma is trying to push vaccines on people. So a lot of the conspiracy theorists are saying it is a conspiracy because Big Pharma is pushing for these vaccines. Now, Merck is part of Big Pharma, no?
No, oh my God. So if you look up how much, like if you look up their revenue for like last year or whatever, like it's way in the billions. Like Merck, the company that makes ivermectin and has a patent for making ivermectin, is the only company that makes ivermectin.
Yes.
Is a multi-billion-dollar company.
Yes.
They are the biggest of Big Pharma. And one of the things I've encountered when we were doing the last podcast, looking up like debunking talking points or whatever for vaccination or whatever, one of the talking points that I kept running into was in favor of using ivermectin was the government has contracts apparently with Pfizer and Moderna and like all these other Indian companies, etc., etc. And so they want us to go and get the vaccine because depending on how many people take the vaccine, the government has to pay the company from our taxes. And the reason why, and this is what was said, the reason why, the government doesn't want us to go and take ivermectin is because the money that it costs for the vaccine is way more than it is for ivermectin, which you can get over the counter or at your local farm store or whatever, and it's much cheaper, and you'll be able to survive COVID off that, which is the most ridiculous.
It doesn't make sense.
I didn't bring it up last week because I couldn't figure out how to
we had
make a case. But if you're thinking that Big Pharma is the reason that the government is telling you not to take ivermectin but to take the vaccine, I would like to point out that Merck is big as fuck pharma.
Yeah.
And if you go to their website, like just to their regular, wait, let me see if I can find it here.
Yeah,
Merck.com. If you just go to their website, there's a link on the front page that talks about ivermectin, and they literally tell you on the front page, don't take this.
Yeah.
At all. Don't take it for COVID. Don't take it for anything that isn't for your animal parasite removal. Or if your doctor has prescribed this to you, and it's like I said, topical. So if you had scabies or if you had maybe ringworm, maybe. But I know for sure scabies and another R word that I can't really pronounce.
Rosacea.
That one.
Yes.
Right. Rosacea.
Yes.
Like if you have those things, get prescribed by your doctor.
Well, yeah, that's something that we have to pause on for a second, though, because some doctors are prescribing ivermectin for COVID-19. However, we need to point out that if you follow kind of where these doctors are doing this kind of stuff, they seem to be aiming for the financial gain. Any of these doctors that I have looked into, they have been saying, pay me $70 and I'll write you a prescription for ivermectin. Now, if they don't care about whether it's effective for COVID or not. Those people are saying, I can make $70 a pop, $90 a pop, and write this prescription for 50 people a day. That's a hell of a lot of money to be making on the side. That's why they're doing it. They're not prescribing it for the purpose of what it was made for.
So, if you are one of those people who are like, Big Pharma doesn't want us to get the vaccine because they, or wants us to get the vaccine so they can get more money or whatever. I'm going to read this directly from the Merck website. This is the company that makes ivermectin. It says, Merck, known as MSD outside the United States and Canada, today affirmed its position regarding the use of ivermectin during the COVID-19 pandemic. Company scientists continue to carefully examine the findings of all available emerging studies of ivermectin for the treatment of COVID-19 for evidence of efficacy and safety. It is important to note that, to date, our analysis has identified 1. No scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. 2. No meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease. And 3, a concerning lack of safety data in the majority of studies.
Oops.
So the company that makes it is telling you,
Don't take it.
Please don't take this. Because we have
So they're not-
nothing to verify that this works.
They're not trying to make a profit.
And they would make a profit. Like, if they came out and they were just like, yo, this thing works.
Yeah.
They gonna make like $2 billion like right there because they know they got
Right.
35 million idiots who are
Yes.
gonna pay $55 for but they're the ones who are saying, listen, when Big Pharma is telling you, we don't want your money.
Yeah.
You should probably fucking listen.
Ties back to the conspiracy theories of why would Big Pharma tell people to get a vaccine that's going to kill them when Big Pharma is reliant on that consumer base to buy their product. Obviously, they're not going to kill off their base. Same thing here. They could be making so much money by telling people to take this, and they're saying, no, please don't.
They're
That
saying
means
no.
It is so dangerous.
You
that
know
they're
why though?
saying no.
It's probably still capitalistic because they're just like, this shit might fuck a lot of people up.
It's a liability
And
issue.
we're gonna have lawsuits out our fucking
Yes.
ass. So we're making it
Yes.
clear to everyone from the get-go.
Yes.
Don't take this. Because when the lawsuits come, we have it documented here that
That it
says
says don't
we
take it.
said not to take it.
Yes.
You fucking moron.
And speaking of lawsuits, some of these doctors that are prescribing it, if you call, trust me on this, or try this out. If you're listening and you've called one of these doctors, confirm this for me, that when you call them and say that you want a prescription for ivermectin, so a lot of these doctors are saying, get the vaccine, but if you still want me to write you a prescription, I'll do so.
Oh.
They're pushing the vaccine probably to cover themselves from lawsuits, because if they're just saying, I'll give you the prescription without giving the precautions.
Speaking of lawsuits, and I know this isn't in our notes or whatever, but I don't know if you probably do because you're smart.
Oh, thanks.
Early last week, in Ohio, in our fucking great state of Ohio, a judge
I'm so glad you're bringing this up.
mandated that the doctors have to prescribe, and there's now precedent for this, saying that his ruling was in favor of this family that wanted ivermectin, even though the doctor was saying, no, I don't want to give it to you.
I have to correct you. The family, there was a man in I don't know if he's still in the hospital, but a man
Westchester County.
Okay, so he was in hospital with COVID. His wife went to one of these teledoctors who had his own website for call me and I'll give you a prescription. He wrote a prescription. The hospital refused to administer that.
Right.
So it's not that, and then the wife took the hospital to court and said, I have a doctor prescribing this, you have to give it to him. Now the hospital was trying to be cautious and say, we don't want to give this to him because we know it's not going to work. Mm-hmm. So the judge did not say the doctor has to prescribe it.
Yeah.
He said, as a judge, he has a prescription from a doctor. The hospital does need to follow through with doctor's orders. It might not be your doctor. I still find this interesting though, because when I got my gallbladder removed, my hospital refused to give me my birth control pill.
Okay.
So it's an interesting precedent that they're even saying the hospital has to administer a pill prescribed by a doctor. My pill was prescribed by a doctor, but the hospital still refused to administer it.
But so
argument.
my issue with this whole thing, and I know we've gone on a tangent because we didn't plan to talk about this at all, but my whole thing is this: when you live in a country where judges with like Juris Doctor degrees are now giving out like medical mandates, you know you live in a fucked up country where doctors are like overriding, judges are overriding doctors and hospitals. Like, if you live in I'm sorry, I don't know where you live, where you listen to this, but if you live in a country where a judge can be like, give them that, get the fuck out of that country.
Well, I just think this is going to be a terrible precedent. Also, it's already conflicting with the hospitals that I've been a patient at, where they refused to give me my own prescription because it was against their religious beliefs.
Were you at like a Methodist hospital?
Methodist hospital, yes.
I knew it.
You know which one. So I was there for surgery, so I was there for a couple of days. I had to skip my medicine. But this judge was not trying to take the side of prescribing ivermectin.
Yeah.
They saw it as a legal issue of one doctor says, I refuse to administer this. The other doctor prescribed it. The patient wants it. The judge was basically saying, you can't not give this patient what their own doctor prescribed. It wasn't really their own doctor, but they paid money for this. So I don't know. I don't like the ruling, but it's definitely not the judge taking the side of ivermectin.
What can the Supreme Court do about this? Because I do believe this is one of the cases where the Supreme Court needs to step in and be like, listen, we are judges. We are not doctors. Stop it right now.
Do you really think this Supreme Court that we have right now is going to side like that? Hell no. They're going to say...
With tenured Amy Comey Barrett and her long list of cases that she's tried, which amounts to zero.
Yes, and I'm gonna talk about this. I'm gonna talk about the Supreme Court later in this episode. So let's talk about what happens when you overdose, because you mentioned overdosing ivermectin is being an easy thing to do because a lot of people are taking the animal grade.
And like a horse weighs way more than a person, which is why it's in grams for horses.
Right.
But it's in micrograms for people. And like I said before, you don't have anything to measure micrograms in your kitchen. You just fucking don't. Don't lie. You don't. It's okay. I don't either. It's whatever. However, ivermectin is a neurotoxin. It attacks the nervous system of the parasites that it's trying to eradicate or kill.
Okay.
It's not supposed to cross what is known as the blood-brain barrier in humans, and that's like when the blood gets circulated to your brain, can it get into your brain and into the cells in your brain? Most things cannot. Like your body is designed where it's just like you can circulate this shit all over your body you want, but when it comes to your brain, we're kind of VIP in this area. Mm-hmm. Only certain things. So with ivermectin, they've attached a pea protein to the medicine, where at the correct dosing, you shouldn't have problems with neurotransmitters or neurological issues or whatever. Mm-hmm. However, when you overdose, when you take more than is required, that whole argument breaks down, and now it can get into your brain. And some of the side effects of overdosing from ivermectin is the first one I saw when I was doing research on this was stupor. Stupor. Literally stupor is like this person has turned into an idiot.
Yeah. Which
I would argue that the person was an idiot before.
I was just gonna say the same thing. We're sharing a brain at the moment.
So we can't even use that to judge if the person is stupid or not.
Yeah, how can you tell?
If you took a dab like a toothpaste size ivermectin, you might be a fucking idiot.
Right.
I don't know what to tell you. Deal with that.
Okay.
So, possible neurological disorders, shutting down of various systems that are connected to your CNS or PNS if it gets into your brain. But we were talking about this before the podcast started, that people were reporting being dewormed.
That's what they thought.
That's what they thought. They're looking at their poop, at their fecal. What are we talking about this? Okay.
It's important.
They're looking at their poop in the toilet or wherever. And they're just like, oh my God. There's like lines and worms and things and whatever. And according to the CDC and other doctors and Merck themselves who make this drug, they're like, there's a very good chance what you're looking at is not worms. But people have been complaining. I know we're going to put the pictures up right here. They're just like, oh my God. I'm feeling better with my COVID, but I'm also being dewormed. And what were they calling the worms? Oh, rope worms.
Rope worms, yes. Rope worms and tapeworms is what they thought they were seeing.
They're like, there's rope worms in my fecal matter, my excrement or whatever.
But it's not really worms.
But rope worms aren't real. Like that's, I took the liberty for you guys to look this up before we started doing this.
Oh, thanks.
And all medical people, yes. Everyone who has some form of degree in studying parasites and immunology or whatever are just like ropeworms are not a thing. It's pseudoscience. That was a word that I came across 3 or 4 times.
Yes.
Pseudoscience. There aren't any ropeworms.
No, but they look like worms, so they're seeing something.
Yeah. What are they seeing?
Do you want to say?
No, I don't. I don't want to do this at all. But
what they're seeing is their intestinal lining that's coming out in sheets, basically long strings. Their intestines are shedding because they're essentially almost like bleaching their intestines. So it's coming off. Now, the lining of your intestine, I've done a lot of research on how the gut works because I've been researching this for the last several years to clean up my diet and eat clean and all that kind of stuff. And I have food sensitivities. And so, yeah, I've done a lot of research here.
These people are shitting out their intestines.
They are. So your intestinal lining has, it does stretch and it does allow things to pass through the walls of it if you eat too many things that cause inflammation. So, but it also has, the intestinal lining is supposed to help break down the food and pass through the food. So if you lose the lining of your intestines, you're in deep fucking shit. You're in deep shit. This is no joke. So let me just draw this picture for you. So what's going to probably happen to these people? This is my assumption or my guess, and I hope I'm wrong. These people will potentially survive COVID, but be very, very on edge for the next thing that disrupts their intestinal order, could possibly kill them or ail them so much that they may not ever be normal again. They could get something like diverticulitis, and that could kill them.
Say that again?
Diverticulitis is inflammation or infection that's caused by eating certain things like seeds, popcorn, and stuff like that. If it gets stuck in your intestinal lining, then it becomes inflamed and infected. It's very painful. So I'm thinking this is probably something that's not a deadly thing. Yeah. But that could be what kills them because their intestines are completely hosed. I'm just saying, this is not something to take lightly that they're shitting out their intestines.
All right. So with these overdoses and these things that are going on, a number of states, I know Oklahoma is one. I read about Alabama and I think Kansas was another one, but not to the same degree. Oklahoma specifically, their poison control hotline is completely overwhelmed. Like they don't have enough people to answer the phones, and they don't have enough ambulances to send out for these people who are overdosing from ingesting ivermectin. The next thing is, because all of the beds in the ICUs are taken up by unvaccinated people, even if they were to send an ambulance to go get this person from overdosing from ivermectin, they don't have anywhere to take them. Right. Like, it's such a revolving door of stupidity.
Right, and because we have to...
I don't understand.
We have to remind everybody, these are people taking ivermectin because they refuse to get the vaccine. Yeah. Because the vaccine is too dangerous.
Or to whatever or to came up with.
Whatever, I don't know. Yeah. But it's the devil's work to kill us.
So
something.
Oklahoma's governor was about to call a state of emergency to try to get people moved from the hospital to like neighboring states or whatever, so that they could, because people Oklahoma. One of my friends is actually from Oklahoma, and she belabors the point all the time that they're like always in the lowest 5 in education. Oh, and like I'm not banging on Oklahoma. I think Oklahoma is great. You guys got a wonderful football team. I love watching y'all on TV. Yeah. However, y'all really need to stop listening to the people who are not the people who have your best interest in heart. Oklahomans, seriously. Your governor is about to call a state of emergency to get people who are overdosing on ivermectin into ICU beds, because the current ICU beds are filled with people who didn't get the vaccine and are now dying from COVID. Like, figure it the fuck out, Oklahoma. Are you serious?
So what's another thing that we need? What's the common denominator here? The people that are filling the ICU beds are all
Unvaccinated.
99% are people who are unvaccinated or taking certain medications to avoid the vaccine and getting very, very ill.
Yeah. Now here's the thing. Like, I know we live in a capitalistic society and money drives everything, right? Vaccine is free.
It is free. Yes.
Okay, it's not necessarily free. Our taxes paid for it, which is what taxes are supposed to do. Taxes are supposed to work for you, supposed to help you. This is a prime example of taxes of the government being like, we're covering this whole thing that's trying to kill the fuck out of us. People in Oklahoma are just like, nah, we're good. We don't want the free shit from the government that we paid for with our taxes. We want to pay extra money for this dewormer, and now we've overdosed ourselves, and now we can't get an ambulance. Yeah.
And now they're going to pay for
You're going to pay for the ambulance. You're going to pay for all of this stuff. And we've already talked about the fact that insurance companies are changing their policy from paying for COVID-related illnesses that hospitalizes you, because they're like, if the vaccine's free, this is now a liability. If you get it, you don't have to get it. You don't. Okay, maybe you'll still get it, but you won't die.
Right.
You won't be intubated. You won't be on a ventilator. So you would rather pay however much money it is for ivermectin, whether in paste or powder or whatever form, than getting the vaccine that you already paid for with your taxes. I don't understand Oklahoma. I don't understand Alabama. Please make it make sense to me.
It's happening everywhere. Because obviously it's happening in Ohio too. But, by the way, tax dollars paying for... This is what the Constitution or Declaration of Independence, for the life of me right now, I can't remember which one, but it says to support the common welfare. This is common welfare.
This is common welfare.
Public health crisis, pandemic.
Yeah.
That's why our tax dollars pay for it.
So what is... I don't know. It seems like not just Merck and the government and doctors and anyone with two brain cells to rub together are telling you, please do not put the ivermectin paste or whatever in your mouth and ingest it, because, or don't put the wrong dosage, or please get it prescribed first or whatever before you're doing all of that. There's just so much surrounding this ivermectin thing. Facebook, which won't stop misinformation from foreign governments from meddling with our psyche and meddling with our elections or whatever. Facebook has denoted, I think 2 days ago, that they're going to remove every single post that has the word ivermectin in it. Whether it's positive, whether it's against it, whether it's giving information like don't take this, whatever. If the word ivermectin gets put in a post, they're deleting it. And you might even get banned for like 24 hours. Facebook is doing that.
So what you're saying is we shouldn't put that in our description.
God damn it, fuck. Because we already had an issue with fucking YouTube last week.
Yeah.
I know. I'm honestly considering like how are we gonna name this podcast, because if Facebook and they're all connected. So like Facebook is removing any ivermectin post. You put the word ivermectin in the post, they're removing it. While this is happening, right? Apparently, a lot of cities are running out of ivermectin.
Okay.
I don't know if did you. Okay, so where they would go to the pharmacy or whatever and be like, yo, I need, so much ivermectin or so much whatever, and they'd pay a fee or whatever and get the dosage. They've been running out because it's not something that pharmacies or vet pharmacies stock in like endless piles, because who the fuck comes in here for ivermectin? Like, how does everybody's horse get heartworm and pinworm and shit and get sick?
It is pretty common, but not in the quantities of humans that are asking for it.
And definitely not in the city.
Because there are apparently a lot of humans who think this is a good idea.
All right.
It's frightening.
So here's what's happening in rural communities. And this might be a laugh, but I don't know. I've been laughing this whole time. So vet pharmacies in rural communities, the pharmacists in those communities are having to question people who they're not familiar with, who come in and ask for ivermectin.
Okay, so people are going to other
Right.
communities.
So they're leaving cities or whatever, and they're going into rural communities and like finding a vet pharmacy or a pharmacy or whatever, and be like, I need so much ivermectin or whatever. And so the vets or the vet pharmacists that are there literally know every animal almost by name in their community. They've been there. They work with X farmer. They work with this. They know this horse's name. They know if this horse is bred for racing or just for grazing or for pulling a plow or for whatever. So when this random person who they've never seen in their life comes in and just like, I need 120 milligrams of ivermectin, they're just like, well, for what? And they're like, I need it for my horse. My horse has heartworm, I think, because he's exhibiting signs of heartworm, infestation. And so what the pharmacists have started to do in these rural communities is ask related questions about whatever animal they're rearing. And if they can't answer, then they just fucking be like, no, I'm not selling you this. So they'll be like, oh, so how many horses do you have? Okay. So what do you feed them? All right. Okay. So, like, what grazing techniques do you use, or how long do you have them covered in the winter or whatever? And so a person who's like from this city who doesn't know anything about rurally raising horses will be like and the pharmacist will just be like, step to the side, please, we don't have time for your bullshit. I'm not selling you that next.
Right.
That's where we are as a country.
Well, that's where pharmacists should be already. I mean, honestly.
Like, we have people gatekeeping on the front lines.
Any good pharmacist should, though. I mean, I think that this has been a problem with the opioid crisis. Too many pharmacists are just filling prescriptions, never asking questions. So I think this is a really good measure beyond just ivermectin, is to say that any good pharmacist is going to ask some questions if they think something's a little fishy. Now... I'm going to explain how this is all related, but I need a couple of minutes to set this up. So just bear with me, buckle up, sip some of your drink.
Okay.
Follow me on this path.
Yeah, tell me twice.
So I mentioned earlier we were going to talk about Amy Coney Barrett, the Supreme Court, a little bit. I'm going to draw the parallel between the Texas abortion bill and ivermectin. So the Texas abortion bill that was just passed went to the Supreme Court. They did not strike it down. So they're basically like, continue to do this. Let me read a little bit of this. Any person other than an officer or employee of a state or local government entity in the state may bring a civil action against any person who performs or induces an abortion in violation of this subchapter, knowingly engages in conduct, including paying for or reimbursing the cost of the abortion through insurance or otherwise, if the abortion is performed or induced in violation of this subchapter, regardless of whether the person knew or should have known that the abortion would be performed or induced, or anybody who intends to engage in this conduct. So what does that mean? It means any woman who gets an abortion after 6 weeks, or any provider that performs it, anyone who gives a ride or pays money to cover it, or any other form of support, knowing that it's going to happen and doesn't stop it, that they could be subject to a lawsuit by some other civilian who calls a phone number and reports this incident.
And I saw at the same time that Lyft and Uber are willing to cover legal fees of any driver that drives a woman to the abortion. Like, this is where the fuck we are.
I know.
Continue.
That's beside the point, though. So we've heard so much about HIPAA rights throughout all of this pandemic. From the Karens and the Chads that show up at these stores and they scream, "It's none of your business about my health." And it's a HIPAA violation to ask me to wear a mask, why I can't wear a mask. It's
not. Just to be clear, it's not a HIPAA violation.
I know that.
Okay.
Again,
you know
follow me on this. Follow me. So it's a bullshit argument, but that's their logic that they want to settle on. So let's follow that. If it's a HIPAA violation to even ask about a vaccine status or the ability to wear a mask, then how the fuck is it not a HIPAA violation to write laws that allow private citizens to be like, you got an abortion, you need to tell me everything. You need to pay me $10,000 because that's a violation.
It is $10,000, isn't it?
They get paid. Yes, they get paid $10,000 for reporting it because there's. We're not going to get into it, but essentially there's a $10,000.
I wish I lived in Texas because
sorts.
I'd be like $30,000 richer by like lunchtime.
Yes.
What kind of shit law is that?
It's shit law. If you all want us to do a separate episode about it, comment, let us know because I'm ready to talk about it. So how does this relate to ivermectin? Well, that bill in Texas is a heartbeat bill.
Yeah.
So if it opens somebody up to civil litigation if they stop a heartbeat of a living human. Okay? So let's say somebody gets COVID. They refuse to get vaccinated. They decide they're going to take ivermectin. So this person that has COVID is driven to the pharmacy by their spouse. The person with COVID walks into the pharmacy to purchase human-grade ivermectin. We'll give them the benefit of the doubt that they're not going to get the horse grade.
They're not getting the horse, okay.
They're even just going to purchase human-grade ivermectin.
All right.
This person's now exposed everybody in the pharmacy to COVID. And let's say the pharmacist who waits on them gets COVID and dies. So following the spirit of this Texas law, which is now precedent because Amy Coney Barrett and the others on the Supreme Court say, it's cool with us. Any private citizen can now pick up the phone and they can say, dude, my pharmacist wife just got sick and died, and I want to bring civil charges.
Because they stopped her heartbeat.
They stopped the pharmacist's heartbeat. And they knowingly went into the pharmacy having COVID, exposing other people to it, all because they wanted to get ivermectin. This is why I'm bringing it up, because I think it's interesting.
This is too much.
The COVID positive person plus their spouse who drove them to the pharmacy, they're both potentially open to civil litigation.
Yeah.
Because they killed somebody. They stopped a heartbeat. It's interesting that conservatives are not seeing just even one step in front of what they're doing.
But see, you touched on a very big point of the whole conservative lawmaking. They can't see further than their nose. They're just like, and it's so annoying to me.
Yes.
Because it's like you can't see, you have this idea and you're just like, we want to stop this and do this, but you don't see the ramifications that happen because of this one thing that you've done.
And this is such an easy picture to paint. Such an easy picture.
Yeah.
But it wouldn't have really been so easy to draw that if it hadn't been for their HIPAA violation bullshit that they were throwing out there. And
I'm sure you've seen the memes. I've seen all the memes where it's just like, Texas won't force a 12-year-old student to wear a mask, but they will force her to carry a child to full term if she's been raped.
Yes.
Come on, America, it's easy to get this right. Just get it right.
It's
not hard to get it right. Just get it right.
And this is what I want to call a boomerang effect that I'm seeing across the board with conservatives.
I don't know why, but you said boomerang and I just stopped at boomer. I just want to blame
Not
them.
a boomer effect. That's totally different. I could do an entire episode on boomers too. I do actually, before we get off of the abortion bill, I do want to say, did you know that government employees are exempt from those rules in that bill?
Really?
Yes. So any government employee that either gets an abortion or
carries someone to an abortion.
Yes. If they're an employee of the government, they have qualified immunity. Wow. So I wonder if this is a backdoor way of Governor Abbott making himself exempt from any prosecution for anything related to the heartbeat bill, not just abortion, but also COVID.
I don't think it's just the governor. I think it includes your boyfriend Ted Cruz,
all of them, yeah.
The other senator, which no one knows. Texas has 2 senators.
Yes.
Everybody knows Ted Cruz.
Yes. I do know the other guy's name. It's just you asked me too quick.
There you go.
We talked about him a few weeks ago. Oh my God. But yes, I wonder if this is a backdoor way of them setting this precedent that government employees are immune from prosecution, even for this bill that they wrote specifically for any civil litigation could be brought. Government employees are exempt.
Yeah.
So the other thing I want to say, the boomerang effect. In such short order, basically every major argument that's been thrown from the conspiracy theorists or the Trump cult or all those people, because it is becoming a cult at this point. Not everybody who likes Trump is in the cult.
It's a cult without a leader, which is weird to me.
They still have a leader. I want to be
It's not Trump. Trump took the vaccine. He's telling them to take the vaccine.
He's still leading them. They still love him.
He's still taking. He took and they're telling him, "Boo, no."
I know.
So
Well, they booed him once. Don't let that confuse you. They still love him. Now, I want to be very clear. I am not saying that everybody who supports Trump is in a cult. That's not the case. But there are a large swath of those people that they basically have taken on cult mentality. Ask any psychologist who has studied cult mentality, and it is they have like 50 different points of the cult, and they meet 49 of them. That's far more.
They meet 12 out of the 14 like checklists for fascists too.
Course. So, yeah, I do want to be very clear. We're not talking about every person who supports Trump. But of the cultists, they have thrown out these arguments for the last several years that have not stood the test of time even 12 months later. So all lives matter, except for when that means wearing a mask or getting a vaccine.
Okay.
Pro-life, except when a pregnant woman is asked to get a vaccine and then she's like, no, I'm going to risk death of myself and my child.
Okay.
My body, my choice. Except when it comes to the uterus, then fuck you. You can't have your choice.
Okay.
Self-governing. We don't need no damn nanny state, except for when it comes to a global pandemic, and then we can't do masks or vaccines until the government forces us to. HIPAA rights. Except when it comes to abortion, and then fuck you, I can force you to go to court and pay $10,000 for sticking my nose in your private business. I just think it's interesting. From the beginning of the pandemic until now, all of these things have fallen apart.
Can I add one to that?
Yeah.
Can I add one to that? Small government, no government intervention, but Texas and Florida are mandating against having masks mandates.
They're mandating to not have the mandates.
So you're mandating to not have the mandates, but at the same time you're making it illegal to have an abortion after 6 weeks.
Yes.
Isn't that big government?
It is. It is big government. So I just find it interesting that a lot of these arguments surrounding ivermectin are just, I would like some consistency. So if you truly believe all lives matter, stick to that. If you truly believe that my body, my choice, stick to that.
You're asking for consistency from hypocrites. It ain't gonna happen.
I'm just pointing out the obvious.
Not
I thought
this
it was
lifetime.
worth talking about. But that's the boomerang effect. They throw it out there and it comes right back in their face.
And they don't catch it.
Oh,
God.
Smack.
Wow.
Yeah. So
that's absolutely crazy. Yeah. Well, you know what? As much as I'm okay with the fact that only the unvaccinated currently are dying from COVID, which I know for, like, I don't need to see the statistics to tell me the truth about this. Mm-hmm. Trump and his camp, the people who are in his base or in his camp, have told him, hey, just so you know, your base is dying because these are the people who are not taking the vaccine, whatever. So he had to switch his argument. He was like, take the vaccine. Remember, I took it. It's safe. If it's not safe, I'll be the first to tell you, whatever.
Right.
And I know that now it's all political, right? You know, it's weird to me that people don't just see that. That, like, yo, he's realized that his base is dying, which means the number of voters who are supporting him are dying. And to put like a full-on cap on it, the people who are taking things like ivermectin and remdesivir and Regeneron and monoclonal antibodies are pushing this argument for you to pay thousands of dollars, tens of thousands of dollars for these things versus the vaccine that you already paid for with your taxes, can afford it. Joe Rogan can afford this cocktail of 5 things.
He can do that.
Trump can afford it. You know, any person that you see on TV probably has more money than you. It's just the truth.
Yeah.
And they can be like, yo, doctor, give me this, or doctor, I'm paying you to give me this, whatever. Mm-hmm. When the bill comes back to you for taking monoclonal antibodies and taking ivermectin and having remdesivir and whatever administered, you won't be able to afford that bill. It's a known fact that like every American is 1 or 2 paychecks from being homeless.
Right.
Why are you listening to these people? It's so weird to me. Why are you Joe Rogan is a millionaire. He literally got COVID and the next day was like, give me these 5 things.
And he got him.
You think you can go up there and be like, give me these 5 things? They'd be like, well, none of those 5 things are covered by your insurance. So how are you paying for
That's
this?
the thing. Joe Rogan has nothing to lose by telling you not to take the vaccine. He's got nothing to lose. So you have a lot to lose if you're not making the paycheck that Joe Rogan has, or Alex Jones.
Or the fucking Fabio guy that you
Bill Phillips. By the way, Bill Phillips is saying, get the vaccine. That's what he's saying now. He said he made a mistake.
You ever notice that all the people who are just like anti-vax and whatever, as soon as they get COVID, they're like their next social media post, whether Twitter or Facebook or whatever, is just like, COVID is real, guys.
Not all of them.
It's real.
I've seen most of them.
Most of them that survived to tweet.
Most of them, but I do want to be very accurate in that statement to say it's not all of them, because I've still seen. I saw I don't remember who it was, but it was CBS or somebody did interviews with people who are in the COVID wing of a hospital actively fighting COVID, and they were asked, "Did you make a mistake in not taking the vaccine?" They're like, no, I don't think I would. I still don't think I would do it. It's but you're still not out of the woods.
But they want to take monoclonal antibodies, which, by the way, are not FDA approved.
We covered this last episode.
I don't know.
Yeah.
Oh my God. So listen, Beth likes to go back and forth in comment sections. I refuse to.
I do.
So if you do want to contact us and go back and forth with someone from Mixed Politics in the comment section, Beth can tell you how to reach her.
Well, if you want to reach out to us, we are on Twitch and YouTube. Also, Facebook and Instagram at mixed.politics on Facebook and Instagram. Twitter at mixedpolitics1. Also, you can email us at mixedpoliticspod@gmail.com. Be sure to go subscribe to us wherever you listen to podcasts, because you can listen to the audio. When YouTube takes our video down again, you can still access the audio like last week. We're going to try to avoid that this time around, but you know what? There's a high probability.
There's a high probability. Because currently, I don't think we can. Did they rescind the whole thing where we can't post for a week?
Yes. So what happened was, for those of you who didn't catch it, because I did have a couple friends reach out to me and say, "Why can't I watch you on YouTube?" I'm like, "What the fuck?" I go to YouTube and it says, "Oh, your video has been stricken and you're not allowed to post for a week because you're spreading misinformation." Which we talked about that last week.
Yeah.
The word misinformation or disinformation triggers us because it's like, it's a lie. Call it a lie.
Call it a lie. Like, were we telling any lies in our podcast? We weren't.
So I basically appealed and said it was because we had certain keywords and phrases that we were using. Yeah. We were talking about hydroxychloroquine. We weren't talking about the efficacy of it. We were talking about kind of some of the politics behind it. Mm-hmm. So because we used certain trigger words,
the AI,
artificial intelligence caught us.
Because
I appealed it, and
no logical person would watch that episode and be like, "This is misinformation."
Right. Because they say that you have to stay in line with what the CDC is recommending, which was exactly what we did, but we were just giving the background information on the other stuff.
Yeah.
So there's a high probability that some of the key phrases and words we're using today, talking about ivermectin, is probably going to get our video taken down. But if you're subscribed to audio, you can listen to it no matter what.
Well, if you do want to donate to us and have us use a paid service where we are less restricted, you can do that at patreon.com/mixedpolitics. And thank you to our Patreon subscribers and to all our analysts, pundits, and experts.
Cheers.
Thanks. Don't take ivermectin. Jesus fucking Christ. Go to your doctor. Talk to your doctor. The one that you've trusted with your reproduction.